We want to make sure your family is prepared for spine surgery. Your care team will provide you with a spine surgery handbook. It's important that you read all of the information that your care team provides so that you are ready for surgery. This video will help you know what to expect and how to prepare in 3 key areas: pre-operative nutrition, hygiene, and pain management. Good nutrition is optimal for your health. You can make a difference in your recovery by improving your nutrition before you have surgery. Start today by eating healthy foods so you get enough vitamins and nutrients. Improving your diet 2 to 3 weeks prior to surgery can help, but improving nutrition 3 to 6 months before surgery is even better. You should eat foods with lots of iron and protein. This includes foods like meats, nuts, eggs, and green leafy vegetables. Drink lots of fluids, especially a few days before surgery, to help you stay hydrated. Your doctor may also tell you to take a multivitamin with iron, zinc, and vitamin C. These are important in the healing process. Chlorhexidine gluconate, or CHG, is a special kind of skin cleaner. Your care team will provide you with this cleaner. You will use it at home to wash your skin the night before surgery. It can be used for children and teens, but cannot be used for babies less than 2 months old. CHG removes more germs from the skin than regular soap and water. This means that there is less chance of infection during and after surgery. Your care team will give you instructions on how to use these CHG cloths. Be sure to read and follow these instructions closely. It is normal to feel discomfort and pain after spine surgery. It's important to remember that the discomfort you feel after surgery will not last forever. Our team will do our best to help manage this discomfort in different ways. These include medicines, activity, rest, comfort measures, and diet. We will work with you to help make sure you get enough pain relief to sleep, turn, or walk as needed. Your doctor will talk to you about the medicines that are the best for you. And you can always talk to your care team or a child life specialist if you need more help. We have a team of trained pediatric pain management specialists that have worked with your surgeon to develop a pain management plan. Here are a few tips from our team to help ease pain. Take deep, slow breaths. Taking deep breaths can help with muscle tightness. It relaxes the mind and allows the brain to focus away from pain. Squeeze someone's hand. Squeezing someone's hand can help focus your mind on something other than pain. Find something interesting to do. Read a great book, watch your favorite TV show, or watch a movie you haven't seen. It's good to find interesting things that can keep your attention. Imagine you're somewhere else. Daydreaming and using your imagination to take yourself to a time or place where you are doing something you love can help get you through pain. Listen to your favorite music or sing. Music is a great way to get through recovery. Have friends and family visit. Having visitors is a great distraction. Talking and playing board games or cards with visitors can help take your mind off your discomfort. It can also be helpful to hear from other kids and teens who have gone through the surgery. Here's what 2 of our patients have said about their experience.
My spinal fusion surgery was January 27th, 2014.
I had my spinal fusion surgery about 2 years ago in May.
Well, I woke up and I realized now that I was in the recovery room and I heard voices around me.
The big thing was the fear of trying to move for the first time because you don't really know what to expect.
One thing that surprised me during the recovery and stuff was when I first started sitting up, I would kind of feel nauseous, but eventually the feeling went away.
I remember them getting me up and walking the day after, and that was one of the scariest things because you just don't know. You know what happened to you, but you're not exactly positive how it's gonna work.
And then the next day, we went down to the stairwell, and I was so nervous about going up these really scary stairs, and they were like, "No, you got this, we're going up these stairs."
What helped me was switching between the ice packs and the heat. So we lay ice packs all along my back and then we would switch to heat and we just keep constantly doing that.
I remember I needed to roll over all the time and so they would come in and help me roll over.
There was pain but I think the thing for me that helped the most was having visitors there.
For pain management, like distraction techniques, I used like a coloring book. Even though I was 15 years old, I had a Hello Kitty coloring book, which also had stickers in it.
I loved having people, just different people coming in and out, talking to me about different things, and just kind of taking my mind off of it.
Just getting dressed was like a struggle at first, but eventually, over time, like I was able to bend down and do those type of things.
Like brushing your teeth. That was one challenge that I had because it's difficult to lean over the sink. And so just little things like that you're like, okay, well, you know, this is gonna take some time to get back into, even though before the surgery, this was something that I could do without even thinking.
When I first saw my scar, I was really nervous because I don't do well with blood, and so it made me like really upset to see it, but really eventually it turned out not to be as big as I thought it was.
It's like a little small, like long scab basically, and now you can't even tell that I have one.
Since it's been a year after my surgery, I have gotten so many compliments on my wonderful posture, and that's always like great to hear.
All my friends were super supportive. I've met people that are nervous about what their friends are gonna think or how everything's gonna work out and what their scar is gonna look like afterwards and that sort of thing. And I just have to say to them, you know, like I'm a good example that everything's gonna be okay, and I'm doing pretty well, and so yeah, everything's gonna work out great.
All of this information and more details are in your spine surgery handbook. Be sure to follow the instructions in your spine surgery handbook so that your body can heal and return to activities more quickly. Attitude makes all the difference. You've got this.